Good evening, friends. Good evening, Dr. Seth. This is probably one of the worst cases that we have seen, which set our hearts palpitating. This is a patient who's 55 years old male, recently diagnosed diabetic, no hypertension, no addict, admitted with unstable angina. The vital parameters were normal. ECG showed an old inferior wall MI with a poor RV1 to V4 with a troponin test positive. 2D echo showed an inferior posterior hypokinesia with an ejection fraction 40%. The angiogram carried out showed a LAD mid-60 followed by a second lesion, circumflex about 70% with involvement of the OMs. The RCA, parent RCA normal with a PDA which was 80%. The patient was subjected to a PDA stent. It appeared to be very simple. And then the patient was subjected at a second stage for the LCX plasty. We have skipped the PDA stenting pictures in interest of the time. You can appreciate that there is a significant circumflex lesion there, which we decided to carry out a PCI. The circumflex was wired, balloon dilated, followed by a stent, which was 2.75 into 38 millimeters, and you appreciate that the flow is good down into the circumflex. Sorry, that's the stent picture. And then post-dilatation was carried out, which unfortunately resulted into a no-flow phenomenon. The standard measures of administering the drugs through the coronary artery failed to yield any result. And then when we took a repeat picture, we realized that it was not just a slow flow, and the patient has developed a thrombotic occlusion with a thrombus in the left main and in the LAD.